Hello, good morning. My name is Helen. I'm going to be your nurse today. How are you doing?
I am good, nurse. Good morning.
I'm performing my hand hygiene. Could you please confirm for me your name and date of birth?
My name is John James. Date of birth is 6174.
Thank you. Do you know why you are here today?
Yes, nurse. I'm here for my annual physical.
Okay. Do you know what month and the day it is?
Yeah, today is November 22nd, 2020.
Do you know where you are?
Yes, I'm at the doctor's office.
Okay. Who is the President of America?
The President of America, Donald Trump.
Good, perfect. By this, I know that my patient is oriented ×4. Do you by chance have any allergies?
No, I have no allergies.
On a scale of 0 to 10, do you feel any pain today?
No, nurse.
Okay, I'm gonna provide privacy for my patients. I'll be doing your head-to-toe assessment today, but before we do that, I'm gonna do your vital signs. Then after that, we'll start the head-to-toe. Do you have any reservation, like religious or cultural stuff that you want me to know about?
I have no reservations, no cultural religious reservations.
All right, thank you. I'm gonna start with your blood pressure. Do you by chance know your baseline for your blood pressure?
My baseline is usually 125/74.
Okay. This is my blood pressure spiral manometer, and it's an adult size because my patient is an adult. Last one for me, please. Thank you. This is gonna be a little tight, but let me know when you start feeling uncomfortable, okay?
Okay.
Your blood pressure is 115/78, which looks good. The normal blood pressure ranges from less than 120 and less than 80. I'm gonna go ahead and do your temperature. Could you open your mouth for me, please? Close. The temperature is 98.6, which looks good. I'm gonna be checking your pulse rate. This is the radar pulse rate. The radar pulse rate looks good. His pulse rate is 88 beats per minute. I will be doing the bronchi pulse rate, and while I do this, I will also do my patient's respiratory because I don't want to let him know that I'm doing that so that he doesn't utter his breaths and everything. Bronchi pulse is +2 bilaterally, and his pulse rate is 16 breaths per minute. Everything looks good. O2 saturation is 98%, which looks good. Now I'm gonna be putting my gloves on to do your head to toe assessment. By any chance, if you feel uncomfortable during this head to toe assessment, you let me know. Just by looking at my patient, he appears stated age, skin color is even and appropriate for his ethnicity. His facial looks good, no drooping and no twitching. He's not flushing. Everything looks good, and he doesn't look anxious. He's cooperative. He's cooperative and responding to my questions. So I'm gonna go ahead to before I start with your head to toe, I'm gonna do your weight. I will have my patient walk to the scale for me to measure. While he's walking, I'm gonna check his gait, and his gait is bilateral. Looks good. And the weight, you check weight, the BMI according you check the BMI according to his weight and his size and date of birth. BMI less than 18.5 is underweight, and greater than 30 is obese. So I'm gonna start palpating. Looking at my patient, the head is normal shape, normal cephalic shape that matches with his body shape. No infestation, no lumps, no lesion, and no hair falling. Do you use glasses?
No.
Okay. You open your eyes for me? The eyes is round, equal, rounded, and is accommodating. Do you use any hearing aid?
No.
I'm assessing his ear. Everything looks good. There is no drainage. There is no swelling or reddish. Everything looks good. So let me know if you feel pains as I'm palpating you, as I'm touching. Do you feel any pains around your ear?
No.
Okay, everything looks good. I'm gonna go ahead and see your nose. Could you raise your head for me? The nose looks good, no drainage, no redness, and nose is not swollen. Could you close one of your and breathe? Close the other one and breathe. Breathe in and breathe out. My patient's nails are working. His airway is free. There is nothing wrong with it. Since my patient has a beard, I will also check for infestation, any reddish, or any sign. My patient looks good and the hygiene is proper. Could you come down for me? No, sit down. Can you open your mouth? Could you do ah? Good. My patient looks clean and articulate, clear, well hygiened, and the lips looks okay. It's not cracked. It's pink and moist. Everything looks good. So I'm gonna go ahead and check the range of motion for your shoulder. Could you shrug your shoulder for me? Good. The shoulder has range of motion. Now I'm inspecting the neck. Everything looks good. The skin color is okay. No bruises, no swelling, no rashes. And I'm gonna check his carotid arteries. +2 bilaterally. And I'm gonna use the bell of my stethoscope to check for bruit, to listen to see if there is bruit. Okay, there is no presence of bruise, and I will go ahead and let me document it. And I'm gonna go ahead and do your. Could you do your hand for me? Check the range of motion for the upper extremities. Could you hold it together for me? Pushing, pushing, pushing. Push my hand. Push out. Push in towards you, towards me. My patient's range of motion, in upper extremities are good. I'm looking at his nails. Capillary refills is less than 3. Everything looks good. The skin is pink and is not flush. There is no swollen, no redness and everything. I'm gonna check his skin toggle to check if he's dehydrated or not. The skin bounce back. There is no skin toggle. That's good. Could you I'm gonna go ahead to listen to your lungs right now to check the sound of your heart to see if everything is okay. Okay. I'm gonna do the same thing. While I do this, can you take a deep breath for me? Out. Deep breath. 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 Out. The lung sounds good. There is no adventitious sound. While I'm at, could you please shift for me and back me somehow? Okay. While I'm still at the back, I'm gonna check my patient's costovertebral angle. Do you feel any pains?
No.
Okay, that means I'm not worried about any organs. Could you put your legs down? Okay, while you are there, could you lie down for me? Your lung sounds looks okay. There is no adventitious sounds. There is no murmur. And I'm gonna go ahead to listen to your hearts. Okay. I'm listening to the aortic, the pulmonic, Erb's point, mitral, tricuspid, and mitral. S1 and S2 is sounding accordingly and everything looks normal. I'm gonna go ahead and listen to your apical pulse for 1 full minute. So just relax for me, okay? Everything sounds good. There's no murmur and there's no squishing sound. While my patient is lying, I'm gonna use this opportunity to inspect his abdomen. It looks flat and rounded. There's no bruises, there's no swelling, and everything is okay. I'm gonna go ahead and listen to the bowel sounds in the 4 quadrants. Just relax for me, please, okay? bowel sounds are present, is not absent, and is not hyperactive. I'm gonna palpate a little bit in the 4 quadrants that I just listened to. And while I'm here, I'm looking at my patient perineal areas. There's no swelling, there's no red. Everything looks normal. Then I'm gonna go ahead and check my patient's pedia pulse +2 bilaterally. Those are pedis. +2 bilaterally. Could you sit down for me, please? Thank you. I'm gonna check the range of motion in your lower extremities. The same thing we did with your hands. You're gonna push it forward for me, backwards, in, out. My patient have 5/5 range of motion in both lower extremities and upper extremities. We have come to the end of the head-to-toe assessment. Do you have any questions for me today?
No questions, nurse.
Okay. I'm gonna give you your call lights. Call me if you need anything before the doctor comes in. I'm gonna be back in 1 hour's time because I have other patients that I have to go out to take care of. Okay?
Thank you, nurse.
Before leaving my patients, I will make sure that the bed, I return it to normal so that my patients does not fall off, and I will make sure I already given him the call line so that he can call me. Just go ahead and relax. The doctor will come in to see you, okay?
Thank you, nurse.
And after that, I have to perform a hand hygiene, document what I just did and my findings, and I will leave the room. I will see you later, okay?
Thank you, nurse.
Mission.